Good afternoon, everyone. I want to thank you for joining us here today at the Precision Health Educational Symposium. My name is Vicki Ellingrod, and I have the honor of being the Education Work Group Leader. For those of you that aren't that familiar with Precision Health, we have some information on the tables. Please feel free to take that with you and share with your colleagues as well. But really, Precision Health is a multi-pronged approach here on campus to really build infrastructure to enable interdisciplinary research with tools and resources that are available broadly across campus. Part of Precision Health also is also funding educational events like this one, as well as research and educational initiatives. And currently they've distributed over almost 6.5 million research dollars here on campus. So if you're interested in learning more about the research awards and the training awards associated with Precision Health, again, please take the information located on your tables. We also have a new analytics platform to help U of M researchers from all disciplines access some of the data that is being collected as part of these research initiatives. And we've recently introduced a Precision Health Certificate program. I see several of our Precision Health Certificate students here in the audience, so welcome to them. This is a program that's open to all graduate students across campus, and you can check with any of the Precision Health staff if you're interested in learning more about that. Next month, instead of a seminar, we're going to be doing something a little bit different. We are hosting a special movie screening at the Michigan Theater. You can see the flyers on your table as well. This event is occurring on Wednesday, March 18th. There's going to be a showing of the movie called Human Nature, which focuses on the scientific and moral aspects of CRISPR technology. After the movie, there's going to be a discussion that's going to be led by a panel of scientists as well as members of our faith community to get a very broad perspective on the message of the movie and what it will mean for us here in Ann Arbor. So I think that's going to be an event that you'll probably want to attend. Today's program is a little bit different than some of the other symposiums that we've had. We've been very highly focused on genetics. And so our speaker today is Dr. Jennifer Roberts, who's an assistant professor of kinesiology at the University of Maryland School of Public Health. She's also director of the PHOEBE Health Outcomes and Effects, or Public Health Outcomes and Effects of the Built Environment, or PHOEBE Laboratory. She received her Bachelor's of Arts degree from Brown University and holds an MPH degree from Emory University Rollins School of Public Health, and earned her Doctor of Public Health degree from Johns Hopkins University Bloomberg School of Public Health. Much of her research has explored the dynamic relationship between environmental, social, and cultural determinants of physical activity, and using empirical evidence of this relationship to infer complex health outcome patterns and disparities among adults and children. So we've asked her today to come share some of her research expertise with us. After Dr. Roberts is done speaking, we will then open up the audience for questions. And with that, Dr. Roberts, thank you.
Thank you. So good afternoon, everyone. Can you hear me all right? Okay. So before I begin, I actually wanted to first thank Vicki and the entire Precision Health team for inviting me here today to present on some of my research and my work. I also would like to thank and acknowledge Tina Prager as well as Lori Robinson for putting together a lot of my travel logistics and the scheduling of today. And finally, I want to thank all of you for spending your lunch hour with me to hear about some of the work that I've been doing over the past 5-6 years. I thought I would actually begin with talking a little bit about my career trajectory, just briefly, and kind of tell you how I landed in this area of active living research. Then I will kind of follow with talking about two of my past studies, the built environment and active play study, as well as the physical environment and active transportation study. And then following that, I'll end with one of the current studies that I recently launched last year and give you a description of what I plan to do with that work. So, in order to answer this question of why active living research, I thought I would actually kind of give you a story about how I ended up in this area. And I think that's the best way, a story of my personal career trajectory. And as Vicki has stated, I finished my formal training in Baltimore at Johns Hopkins. And at the time, I was really set on becoming an environmental health consultant. My formal training is in environmental health sciences. And I thought I want to be an environmental health consultant and be like this Aaron Brockovich and go and save these different issues. And I was also set on moving to San Francisco. I wanted to go to San Francisco because I thought it was such a beautiful, beautiful area, and I just was set on moving there. And so I did get hired at a consulting firm that was based in downtown San Francisco in the financial district. However, I lived on the other side of the bay and approximately 30 miles north of Oakland. So as you could probably determine from the map, my commute was about an hour and a half. That's one way. So and that's a commute where there was some driving to get to the Bay Area Rapid Transit, or BART, and so hopefully BART was operating that day or appropriately, and so my commute could sometimes end up being much longer than an hour and a half. Needless to say, I didn't really have the best habits. I was eating fast food on the road. I was irritable because I had a lack of sleep. Physical activity, that was not happening. I pretty much just lived on this side of this physical activity scale. And I just was thinking, like, my life is kind of miserable, and I knew that I needed to do some type of change. And so I was thinking, you know, maybe it's time for me to move to California. And it's funny because my husband was also ready to leave too, probably because he was tired of me being so complaining all the time. And so, with the exception of a puppy that we had just gotten a few months prior, it was time for us to leave. And so we were ready to leave. And so where did we leave? We left in November, and we ended up in Illinois. And mind you, I said we left in November. And so it was quite cold, the adjustment. But I switched firms, and I lived in a suburb right outside of Chicago called Elmhurst, and my office was located in Wooddale. And what changed drastically was my commute was only about 15 minutes one way. And this was even during some of the highest snowstorms, and where you can see a picture of me and Kofi, where we are in the midst of I don't know how many feet of snow that came. And so how did this change kind of impact my health, my well-being? It impacted it quite significantly. I was able to increase my hours of sleep from 6 to 9 hours. I mean, you think about all the hours of commuting that I was able to shave off. I was also able to increase my physical activity from non-existent to about 400 hours a week, and 400 minutes a week. And this wasn't necessarily a matter of like me going to the gym, doing these structured type of activities. It was a lot incorporated and just embedded. Walking, like real walks for my dog, as opposed to just letting him out the back door and saying, go to the bathroom. You know, actual real walks. I actually started a garden in my backyard, started hiking. So many different activities were just interwoven in my life, which encouraged some type of movement. So how did I get to Maryland? Well, during this time, I also was thinking, okay, I'm really enjoying this kind of lived experience I had. I mean, even something as simple as when I went to the doctor, you know, I'd had different health markers that were improving. And so I wanted to kind of explore this. And in conjunction, I was becoming a little bit disenchanted with working in the consulting field. I wanted to kind of become a little bit more, delve into a research area, and the paradigm of the consulting firms that I worked on were very much task-based, and you would do a project and then that was the end of it. And so I wanted to kind of look at this whole ideal of what did this lived experience tell me? You know, what did this lived experience tell me about how my environment impacts my health? And so what I did is I accepted an academic position in Maryland, and I moved to the DMV area to really understand this relationship between built environment, physical activity, and health. The first institution I went to was Uniformed Services University, and this was a good place for me to kind of cut my teeth into switching out of this private sector of consulting into the academy. And I was there approximately 3.5 years, and then I accepted a position at Maryland, and I've now been there for 5 years. And as Vicki has stated, I'm in the School of Public Health and in the Department of Kinesiology. So that kind of gives you an idea of how I ended up in active living research and also in the Department of Kinesiology. I always joke and say I'm the only person in kinesiology in my department who has never taken a class in kinesiology. But I fit in the department. So in any case, I'm going to pivot and talk a little bit about this BEAP study. And this was really probably one of my first studies, well, it really was the first study that I did in this new research field that I entered in. But before I get to that, I kind of want to just kind of look at the context of what drove me into that. So we understand that, you know, obesity has been an issue in the United States as well as other countries throughout the world. This has also been an issue for many of our youth. We today, roughly 18.5% of our children between the ages of 10 and 17 are obese, and this is what is going on today. But at the and also in the DC area, obesity is now roughly about 14.3%. So it has gone down. However, when I started this study in 2011, we saw that the obesity rate was much higher. And specifically in the DC area, it was over 21%. And DC was actually ranked 3rd in terms of childhood obesity within the nation. And so I was thinking, you know, this is something I wanted to explore, particularly in the greater DMV. So when I'm saying DMV, I'm meaning Maryland, Virginia, as well as the District of Columbia. And what we were seeing is when you combine overweight and obesity, that range from just slightly under 30% to about 35% of the children were actually obese. Coupling with that, we saw that there was a high level of inactivity. Approximately 80% of the youth were not achieving their daily recommended physical activity of an hour. And so I wanted to kind of explore this specifically and how this was related to where these children were living, what their built environment, how their built environment was impacting this. And up until this point, there has been research, definitely, particularly with adults, you know, looking at this relationship of built environment, physical activity, and health. And overall, we've seen that when there's environments with a poor quality built environment, so lack of sidewalks, low intersection density, low lighting, we know that it's associated with lower levels of physical activity, as well as higher rates of overweight and obesity. There's been some also research in youth, but not nearly as much as in adults. And in addition, a lot of that research that has been done in children have been in populations where the population of children are more than 80% white. But we have seen some research, and we have seen similar trends where there is an environment that's promoting the physical activity. Children are more likely to engage in physical activity. But one key thing that we did find as some of this research has been done is that you can't necessarily do adult research, find something, and then extrapolate it to the youth population, which is probably very similar to a lot of other research areas. An example of this is when you see these two figures, the one on the left, which shows more of a kind of a cul-de-sac neighborhood, versus the one on the right, two varying different types of built environments. The one that has the grid style, when you have the grid style type of neighborhood, adults are more likely to be physically active. We walk around the block, we run around the block, so it increases our chances of being physically active. Conversely, when you have a cul-de-sac type of neighborhood, children are more likely to be physically active. And that's typically because you have the circular enclosure, you have lower traffic, you have slower traffic, but also equally important, there's a higher perception of safety. And a lot of times in built environment research, we really look at the objective. You know, we take the GIS, we do these measurements, we take street length, but the perception is equally important. And so if mom and dad feel like it's safe, then the children can go out and play. So the research, again, like I was saying, has been done, but I wanted to do a study specifically in the DMV because I wanted to do this study to look at not only active play behaviors, so physical activity, sedentary behaviors, and active transportation, but I wanted to do it in a population of children that was much more diverse than what had been done previously in some of the other studies. And so, as I said, we looked at many different or those three main different outcomes of activity, but today I'm going to just focus on sedentary behavior. So basically, this was a cross-sectional study design, and we deployed our questionnaires in the fall of 2014 to the 2,000 parents of children between the ages of 7 and 12 years of age that were residing in select DMV areas. As you can see from the questionnaire, there was many different modules. We asked, questions on child active play, child sedentary behavior, even parent physical activity. We asked questions on the neighborhood characteristics, parent rules, parent neighborhood perceptions. And what we did, we also employed a stratified sampling method because we wanted to make sure we got a distribution of different types of built environments. So we didn't want to send it all 2,000 to a very urbanized area where there's a high level of walkability. We wanted to send it to some rural areas, some suburban areas. So we employed Walk Score. I don't know if you all are familiar with Walk Score, to use as a tool to stratify our different types of built environments. So we could have some that were maybe the grid, some that were maybe the cul-de-sac, just more of a distribution of built environments. We were able to classify it into these 5 strata, from a very high walkable area to a very car-dependent area. And so again, we deployed these questionnaires into 7 DMV areas, the District of Columbia, along with 6 of the major counties within the whole entire DMV metropolitan area. Within this study area, there was about 2,901 block groups. So each one of these block groups were assigned a Walk Score. And as you can see from here, looking at the inner part where you see that kind of the diamond, that's where the District of Columbia is. So it's much bluer. So the darker the blue means it's more walkable. Where you look at some of the lighter blue areas, that means it's less walkable. And so we use this kind of Walk Score as a proxy to set up these 5 different strata. And once we were able to have that, we purchased these 2,000 addresses, and were able to, based on the number of households that had children between the ages of 7 and 12 years of age. And so we looked at, with respect to this particular analysis I'm going to talk about, we looked at home built environment variables, we looked at the presence of electronics in the child's room, parent rules, and demographics. And today I'm just going to focus on the first 2 with regard to results. For our dependent variable of sedentary behavior, we looked at it in 2 ways. One, by days, and also not only by days, but how this sedentary behavior was spent. Was it spent alone? Was it spent with a sibling, a parent, or a friend? And then we also looked at it by hours. And by hours, we looked at the type of task. Were they watching TV? Were they doing homework? Were they riding in the car? And using all of these variables, we then just ran an ordered logistic regression to see the associations. So what we ended up with was a sample of about 144 children. The average age was a little over 9.5 years of age. Over 30% of our sample was African American and Asian, and roughly 10% of the sample, of the entire sample, was Latinx. The highest proportion in terms of sedentary behavior, daily sedentary behavior, were found among white children, those who were a little bit older, so those who were in 4th through 6th grades, those with pre-existing illnesses such as asthma, ADHD, or overweight obesity, and those who were from more affluent households. The most frequently types of sedentary behavior that we found were car riding as well as doing homework. With regard to the relationships, we saw that roughly 38% of the children, of the participants, were sedentary every day independently, so alone. This was also similar to about 38% were done 1 to 2 days with a parent as well as with a friend. In terms of some of the associations we looked at, we found that when the child did not have a television in their bedroom, they had lower days of sedentary behavior as well as lower hours of sedentary behavior. Regarding the actual home-built environment, we found significantly that when the child did not live on a cul-de-sac, that there were higher odds of sedentary behavior, which makes sense. So there's probably no safe place or no perceived safe place for them to maybe go outside and play. So what are they doing? They're probably inside doing the sedentary activity. Also, even though this wasn't statistically significant, we saw that when there was no front yard, there was also a higher odds of sedentary behavior. And similarly, when a child lived in an apartment as compared to a single-family home, which probably ties into having no yard, there was also higher odds of sedentary behavior. So one of the goals of this study that I set out to do was to do a study, and actually it was a study that I tried to replicate that was similarly done in San Diego and Seattle by a mentor of mine. But I wanted to do this study in a more diverse population of children. And so we were able to achieve that in terms of being able to have, as opposed to having 80%, 90%, which many of the other samples have done, ours was slightly over 50%. Overall, we found that car riding was the most frequently typed for this region, which was unique to many of the other studies that had been done. This wasn't surprising to me, considering the congestion, the long commutes in the DMV area. People pretty much live in their cars, so I wasn't surprised about the car riding. I was a little surprised about the high proportions of sedentary behavior with a parent. Not so much with a friend, but some of that has been consistent with other studies. And then equally so, other studies, just like ours, found that when there was a television in the room, the children were more likely to be sedentary. And similar with not living on a cul-de-sac. So, as I said, we looked at other outcomes. We looked at physical activity, specifically active play. We looked at active transportation. Here's a list of some of the other papers that we have published based on some of those findings. If you're interested in it, I can send you some copies or show you a copy of this slide. So now I'm going to kind of pivot to my next study, which was very different than the BEAP study. Very different in terms of the fact that it pushed me in an area that I did not anticipate going into. I knew that it was going to be different for me because this next study looked at, I used qualitative methodology. And for the most, I've always been more of a quantitative researcher. And so this was an area that I was kind of pushing myself into. But the key thing about this research took me into an area where it kind of was cast with a very strong sociological lens that I had not necessarily anticipated was going to happen. I kind of looked at this research very myopically, thinking that I'm going to look at the physical environment in reference to active transportation. But I didn't necessarily consider some of the social, political, cultural issues that I was going to actually uncover, which is what I did. And so I say all that to first show you this first slide. Do we all remember who this boy was? Does anybody remember who he is? Right. So this is Trayvon Martin. And he was engaged in active transportation before he was shot and killed by George Zimmerman back in 2012. Zimmerman called the police and said that Trayvon looked like he was suspicious, but he was just walking home. And as you can see from the red patterns, these are possible 2 patterns that Trayvon was walking before he was actually shot and killed. And then subsequently, Zimmerman was acquitted of second-degree murder and manslaughter. But the key thing is that Trayvon was engaged in active transportation. And this whole idea of walking while black has been a term that has now kind of morphed into many different nuanced definitions. Initially, it was a term that was first referenced back in the 90s during the Giuliani era of New York City. Giuliani era in terms of him being a mayor in New York City. And it was really an expression just to talk about the racial profiling that many of the African-American residents were experiencing by the police. It has since kind of morphed into other nuanced definitions, still with the whole racial profiling, but this whole idea of walking while black, biking while black, and even some of the other issues in terms of running while black. The other key thing, though, is that that has to do a lot with the discriminatory practices and racial profiling, but this phrase actually has extended to another meaning of looking at higher areas of risk for just being a pedestrian in crosswalks. There's been research that has been done in Las Vegas, research that has been done in Portland, that has looked at when an African American, regardless of a male or a female, is in a crosswalk, motorists are less likely to yield. And this research has been shown over and over again where motorists are just less likely to yield. And then there's also been research showing that when an African American has a bicycling accident that's most likely to be fatal, most likely to be a hit and run. So in addition to this whole idea of racial profiling, criminalization, also that we've seen in the Chicago area where African Americans were biking, they're more likely to be ticketed, this whole walking while black, biking while black, running while black has kind of looked at a whole nother meaning in terms of when you look at active transportation. So I say all that because, like I was saying initially, when I embarked on this study, I really was just kind of going in very myopically thinking I'm going to talk to some kids, talk to them about their active transportation behaviors, their experiences, their perceptions, in reference to a new metro line that had opened in the DMV, which was the Silver Line that opened in 2014. And as you can see from the map, I think I have a larger one that's coming up. This is a map that extended out and expanded the whole transportation fabric. There was an absence of heavy rail and public transportation in this area where the line opened. And so what I did was I conducted some focus groups. And as I was saying, this was an area that was new to me in terms of gathering or collecting and analyzing, interpreting qualitative data. I did 4 focus groups, about 15 girls, 9 males, between the ages of 12 and 15 of age. Over 90% of the participants were African American or Latinx. And I did all of these in the Reston Teen Center. And then using this, I transcribed the audios and did a thematic analysis to look at some of the themes that were uncovered. And so one of the things that I looked at was I looked at active transportation behaviors, and I looked at the determinants of active transportation. And I'm going to focus mostly on the determinants today, but I can say there were many different family and friend factors that influence active transportation behaviors. Specifically, if friends were saying, oh, let's walk, then the kids were more likely to say, I'll walk, even if they didn't want to walk. Family influence kind of ties into some of the determinants, which I'll talk about momentarily. So there was 3 that I was able to focus on. One was racial profiling, adultification, and sexualization. And so what I mean by this is specifically with regard to the racial profiling, some other participants were basically stating that they felt that there were certain spaces that they were prohibited from going to, prohibited from engaging in walking transportation, prohibited from walking in. They were also told by their parents, don't walk in this space. And I had one participant who said, one time one of my friends were riding my bike and my neighbor yelled at her for no reason. He's like, get the blank off my yard. Like, what the blank are you doing? And so I had asked the participant, I was like, what did he say? And basically it was a racial epithet that this child had experienced. And so this is something like I was saying during this focus group, I was not, my eyes were open. Even though I knew many of these issues in the back of my mind just from my own personal experiences, I was not anticipating that this was going to come out from these children. When I'm talking about adultification, this is when you prematurely or inappropriately push a youth into an adult role or adult responsibilities. And this was seen more from the boy participants. The boy participants were saying, my mom forces me to walk, regardless of his age, or regardless if he has a mate to walk with. Or he said, if I'm at home, I have to walk. I have, if I need to go somewhere, I have to do it myself. And so that was interesting because the converse was true of the girls. They were actually experiencing a degree of sexualization in the sense that girls were saying, well, I don't feel safe walking by myself because of the catcalls. And if I do go somewhere, my mom tells me I need to walk with my brother. So there was this whole issue of I'm nervous because of the sexualization, but also if I do go out, I need to be accompanied by a male relative or a male friend. And so sexualization, which is a form of adultification, this was just mostly keenly seen with the girl participants. And so what I was able to see was that it wasn't just about sidewalks. It wasn't just about, appropriate lighting in terms of the built environment. There were many environmental and social factors that converged on the experiences of these African American youth. And a lot of it was either personal safety, microaggressions, harassment. And it made me take a look at some of the unintended consequences of active transportation. Yes, we know that there's many, many different benefits. The physical activity benefits, the benefits from the environment, there's less tailpipe emissions. There's many, many different benefits. But we have to understand that there's an inherent level of privilege with engaging in active transportation. Are you able to freely go into certain spaces without being questioned, without being harassed? And for some groups, that is not the case. And so when I look at this, I see that with active transportation, there's sometimes a lack of physical activity freedoms. And I just, as an example, you know, all these pictures up here are from African American males between the ages of 17 and I can't remember the top end. But these all of these African American males were engaged in some form of active transportation before they were killed subsequently. So I gave you a quick snapshot of some of the analysis that we did, and this is the paper that we published last year that kind of gives you more of a more in-depth analysis, in terms of the actual quotes that we were able to uncover from the children. So, pivoting now to the final study that I want to talk about. This has to do with also active transportation, but this has to do with the purple line that is coming to the DMV. I say the purple line is coming because it's with some great anticipation for some and some dread for others. And so I'm going to look at whether or not this purple line will, quote unquote, make people healthier. And this line is anticipated to begin operation in 2022, although there was an announcement at the end of, in early December, saying they're probably going to open part of it in 2022 and the other part of it in 2023. So to give you kind of a little background of the DMV transit system. The transit system was initiated back in 1967 with kind of a interstate compact between Virginia, the district, and Maryland. And they wanted to kind of develop, plan, and build this regional transit center so that they would have this kind of encompassing area to help people commute. The first step was through the acquisition of 4 regional buses that happened in 1973. And then about 3 years later, the first little piece of the metro system opened in 1976. I don't know how many people have been to DC and rode the metro, but the red line is the oldest line, and it's the line that's always breaking down. But it's understandable because, I mean, that's what, you know, 43, can't count right now, but 40-some years old. So in any case, it opened with 4 stops. And you can see it's grown over time. And finally, basically, it now has about 6 lines, including that silver line that I had just told you about. And you can see from this upper part right here, that's the new silver line, and they're still expanding to go further out to Dulles Airport. So there's 6 lines, about 90 stations, 90 or 91 stations, and over 100 miles of track line. And so this is how the current system looks. And what will happen is this purple line, it's not going to be heavy rail, it's going to be a light rail line, so it's above ground. And it's going to be a 16-mile east-west line that will conjoin 2 counties, the Montgomery County right here with the Prince George's County. It'll have a total of about 21 stations, and it will connect to 3 of the Metro rail lines, the red, green, and the orange. So, as you can see from this map, you can see that only part of this purple line has the dots. And that's because that's the area where my research is going to take place. It's going to only be in Prince George's County initially. And I'll tell you the relevance of that momentarily. But I wanted to show you more of a kind of geographical distribution of where the line is in reference to Washington, D.C., and how the line, you can see it connects between Bethesda and Silver Spring. So it's kind of remedy this age-old problem that we've always had where people wanted to get from Silver Spring to Bethesda, which is really only roughly maybe like 5 miles at most if you're driving. But if you wanted to take the red line, it would be an hour ride because it goes all the way into the district and goes back up. So this purple line is hoping to remedy that issue. So my overall objective of this study is pretty much to just do a natural experiment, a pre-post purple line study, a case comparison design, cases meaning people who are living within a 1-mile buffer of the forthcoming purple line transit stops, and the controls of people who live outside of that buffer. And then really examine some of the environmental and social and contextual effects on people's active transportation behaviors as well as other health outcomes. So this is an example of the buffer area of the research area, and you can see that, you know, the 11 stops that are on the Prince George's County side, this is where this 1-mile buffer lays out. And getting to the point where I was saying this is only going to be in Prince George's County, this is primarily because of the fact that 2/3 of adults in Prince George's County are overweight or obese. This exceeds the entire state. There's also significant disparities with respect to overweight and obesity. 75% of African American and Hispanic women are also obese. Equally so, there's a lot of physical inactivity. Less than half of adults are achieving their 120 minutes of physical activity a week. And there's also disparities that we see with that, where 57% of African American women and Hispanic women are inactive. And so what's key about this also is that Prince George's County is unique because 80% of the population in Prince George's County is African American and Hispanic. And unlike other similar natural experiment light rail studies that have been done in Utah, that have been done in California, and I believe Charlotte, this will be a population that we will really have the chance to have a much more diverse sample. I mean, you can't help it, it's 80% of the population. So this is one of the unique aspects and a gap that we hope to fill. As I was saying, we're going to look at a lot of the contextual effects and understanding how those effects impact active transportation, physical activity, and health. Obviously, the built environment, that's going to be one key thing. The social demographics, that's key because what we've seen a lot in light rail transit, where you have the introduction of a new light rail line, you have what is called transit-induced gentrification. So we've seen a shift in the demographics of that area when you have this transit-oriented development. So we want to look at how the demographics may change from now, this pre-purple line, the construction period, to the post-purple line, and see how those may affect these health outcomes. We're also going to look at sense of community. Sense of community has to do with this whole idea of, whether you feel like you belong in a certain community. And it's key because when you think about it, when you're engaged in an active transportation behavior, specifically walking, there's a higher level of intimacy with that space you're in. You're looking at the houses, you're looking at the people, you may even speak to the people. You don't get a chance to do that in your car. Well, maybe you do, but I can't drive and do all that. So it's one of those things, you have a higher level of intimacy. And you might walk the same route again, and you might speak to the same people again. And so you have this higher level of community and this higher sense of community when you engage in active transportation. So if any of the things change, if the built environment changes, if some of the neighbors begin to change, possibly from gentrification, but possibly from other reasons, you may lose that sense of community. You may also not feel like engaging in active transportation. So we want to actually do this longitudinal study to look at this at the neighborhood level, and also, as I said, with a diverse population. And then the other aspect is considering that Washington, D.C. has the second highest transportation ridership throughout the U.S., we thought it'd be interesting to do a study in this area. And I really do like doing natural experience. I've never done one, but I think they're the coolest thing. So, so that was another reason why I wanted to do this study. So we're going to look at many different health outcomes. Obviously, we're going to look at purple line, light rail transit use. We're going to look at active transportation overall. So are you biking to the transit? Are you walking to the transit? And even though public transportation, you may think, well, that's not really active transportation. But it is, because either on the origin side or on the destination side, there's usually some human-powered movement that you have to partake in. Then we're also going to look at overall physical activity. Research has shown that when people engage in active transportation, that may increase, but their recreational or leisure may go down, so you don't have a net increase in physical activity. We're going to look at obesity and cardiovascular risk related to some of these changes that have occurred possibly because of active transportation or physical activity. That'll include body mass index, hip to waist to hip ratio. We're going to look at, again, some CBR, so conduit artery function, pulse wave velocity. And then we're also going to look at how the neighborhood changes. So this will be done looking at neighborhood audits throughout the pre-period, the construction period, and the post-period. And we will also have participants complete travel diaries. So the goal is to have 3 different participant groups. One is going to be the baseline group. So these folks will just complete a questionnaire at 5 different data collection points. 2 will be the pre-purple line points, and then the other 3 will be post-purple line points. The second group is the intermediate group. They'll do the questionnaire as well as they will also do accelerometry at those same 5 collection points. And then the third will be the questionnaire, accelerometry, and then they will come into the lab and we will collect some of those cardiovascular risk measurements at the same 5 data collection points. So this is basically a whole timeline of how this study is planned. And I show this because of the fact that we did start this last fall. Actually, I'm sorry, we started last year, initially with some focus groups. And when I did the focus groups initially in 2018, I was noticing I was getting a really narrow slice of folks, and I was thinking, I'm not getting people who may not want to talk to me. I'm not getting people who may say, okay, I'll talk to you, but I want to give you my name. So we then went back to RB and we said, okay, we want to do some transit stop interviews, and we want to be able to audio tape these folks. We don't want to get their information. We just wanted to just talk to them about their perceptions of the Purple Line. So we started doing that in 2018, and we go to bus stops. We go to some of the heavy rail stops. And this was key because the population that I was missing was the Hispanic population. We have a large immigrant population. And so being able to actually go to the stops, I'm now able to be in their space and engage with them and get some of their perceptions and even their knowledge of the Purple Line. I don't have time necessarily to talk about some of the qualitative findings that we've had today, but we plan to do that throughout the course, the life of the study. And then at the end of last year, we actually deployed our questionnaire, and we've been able to collect some data. Hopefully, right now we have a grant that's actually under review at NIH. We will get the funding to be able to do the accelerometry as well as some of the other aspects that we want to look at. So as of February 2nd, we have actually collected about 275 questionnaires. And you can see the distribution between those who are cases and those who are controls. This doesn't show the whole 275 because a lot of those are still being geocoded. But right now we're seeing kind of a almost 50-50 distribution. We have slightly more cases than we have controls. And so we will be able to adjust that. So I wanted to make sure I acknowledge a lot of the people who I work with. I do not do this by myself. I have several investigators I work with. Some here with me at the University of Maryland in various different departments of behavioral community health, in epidemiology. I also work with someone who is in New Zealand. She's another colleague of mine, a colleague of mine at University of Washington. I also have someone in Texas. So it's just a whole litany of people that I work with different types of expertise and specialties that they bring to the table. And lastly, I couldn't do any of this without many of my students, many that I just too many to actually really name, but many of the students work with me. They're the ones out there doing a lot of these transit stop interviews and doing a lot of the focus groups with me, and so it's really helpful to have the students, participate in a lot of the research that I do. So I thank you for your time, and I'm definitely open to questions.
Thank you so much. This
Sure.
really was amazing. I'm from DC and I live on the Red Line, so
Okay.
really appreciate this. I have just a couple questions about things that may or may not influence your work, and I'm interested in how maybe gentrification and mental health outcomes may influence some of the ways you're conceptualizing your last study.
Okay. So the question was how I'm considering issues of gentrification and mental health with regard to the last study that I discussed. It's interesting you say that because I actually have another study that I'm going to start, and that's going to be, I call it the Gen study. So I have this habit, I need to name every single one of my studies. I even named my lab, so I think I'm most proud of the PHOEBE lab name. But anyhow, I have to name, and that one's called GENS. I forgot what it stands for already, but that's going to look at actual gentrification, the perception of gentrification in relation to anxiety, as well as in relation to some risk factors for cardiovascular disease. And so that one, actually, we hope to deploy the questionnaire this summer, and that will have 2 different data points of collection during the pre-Purple Line phase. Because what we have noticed is when we're doing the transit stop interviews, some of the participants will say, my rent has already increased. and I'm afraid that it's going to increase again. Or we have some who are saying, I'm afraid that my rent will increase. We've already seen many businesses close, so we've already seen kind of the business side of gentrification. But there is definitely a presence of anxiety in terms of the residential gentrification and the displacement that may occur with regard to this purple line.
I'm from a department of kinesiology too, so interesting work. Any data, it's not like you're following adults, but are you going to get any information on an entire family, like the children, and how this might be influencing their active transportation and physical activity levels?
So the question was whether or not I was going to start to look at the entire family as opposed to just looking at the adults regarding some of the outcomes we're looking at with active transportation. It's interesting you say that because as you can tell from the first two studies, I'm drawn to the kids.
Yeah.
With this study, I initially was going to do adults and children. But a lot of my collaborators are like, NIH is going to look at you like you're crazy right now. So why don't you just focus right now. And it's just a little easier sometimes with adults, you know, in terms of the consent and everything. And so my goal is to first start off with the adults and use the adults to have like kind of a snowball effect or spin-off type of study just specifically for for youth or even some of their partners in the household. So I had to kind of narrow it down so that I made sure it was a much more focused approach. But I would have liked to just looked at the youth first. Particularly since that's where my heart is a lot of times, but I needed to focus just on the adults first.
So this is definitely targeted adults 18 and up.
Yeah. 18 and up, and actually I failed to mention this. So this purple line, like I said, it's 11 stops in Prince George's County. Of those 11 stops, 5 are deemed UMD, University of Maryland stops. And so those 5 stops will be free for staff, faculty, and students. However, I'm excluding students from the study because they're not bona fide residents, but one of my PhD students wants to kind of just do a side project and look at what some of the students are thinking about, because the students are already, they don't like it. I mean, the campus, it's construction all over, their pedestrian patterns have had to change, it's very disruptive. So I can understand it, and one of the symbol M that we have where they take pictures at graduation, that's going to be moved, and so it's a lot of different things that they don't really care for, and so we want to probably do like kind of a small scale study just looking at some of the students' opinions of it.
Hello, thanks so much for coming. I'm currently in the School of Urban Planning, so specifically in transportation planning, so this is highly relevant and highly interesting to me. I was just wondering if you knew the process of when the government was laying down the purple line, if they had, if they conducted like any focus groups on their own regarding different stakeholders that may or may not be affected by this line, because I know that, for example, when you said that the residents were worried that their rent has or will have increased, I'm wondering if they're like economic developers who have input in this and how much sway they may have in the conversation. Yeah, thank you.
So yes, focus groups know that wasn't happening, but what they have is a Purple Line Coalition Corridor, and that's composed of many of the people, the stakeholders within the area of Prince George's County, and also specifically Montgomery County. So I didn't talk a lot about that side of the Purple Line, but Montgomery County is really they actually had litigation trying to sue and not have the Purple Line and have it stopped, but they, you know, it didn't work. But a lot of people are looking at these issues, and so people from our Smart Growth Center on University of Maryland are also on that team looking at kinds of effects to prevent this type of gentrification. But a lot of it is what I call the gentleman handshake. There's nothing in writing, there's no hard-nosed policy, so people are, you know, they're nice on the beginning end, and they're saying, oh, we're all going to work together, but there's nothing to necessarily actually really make sure that happens. So, but there's definitely, we have meetings all the time, the Smart Growth Center, and as well as the School of Urban Planning, Landscape Architecture also has been working on this. And we are trying, you know, to make sure that we prevent this, but like I said, it's really just a handshake kind of agreement and nothing to really enforce it with the developers, so.
So I actually have a question. So in the newspaper article that quoted you on whether it was going to make people healthier or not, what is your hypothesis?
So I think it could, but not necessarily the people who were already there. I do think this one area particularly along the line, it's called Langley Park. It's actually going to have a stop. And I feel like that is one of the most vulnerable areas. It's a very high immigrant population. I mean, you look at it and everything, you can almost think that you're in Latin America. I mean, it has some of the best food to get there, the music and everything. And so I think because of that, it makes it very vulnerable. And I think we will see displacement. I mean, I don't see how it's going to be prevented. I don't have a lot of faith. Maybe I'm cynical, but I do think there will be benefits to health, but not necessarily maybe to the people who were already existing residents there. Some who may be able to stay and hold out, but I'm not completely sure that the purple line type of benefits in terms of physical activity, in terms of other aspect, will be beneficial to those people.
So as a follow-up question, then what is your follow-up then? You just have 2 assessments after the purple line comes in?
3.
3. Is that going to be enough time to determine if people are actually leaving?
Well, it's going to go all the way 24 months out. So we're hoping that it does. That typically is kind of a benchmark in terms of 2 years. And so hopefully we'll be able to see that. And so, you know, when we file our participants, if all of a sudden, you know, they almost self-exclude themselves because they're like, we no longer live here, you know, I'll be able to follow up and say, well, where are you moving? And I'll be able to see patterns of where people are moving, if they are moving at all. So about 2 years out.
You mentioned thank you for the talk. You mentioned NIH as a funding source. Do you have other funding sources or interested parties that are seeing outcomes of this work?
So the question had to do with funding sources. So I pretty much work on a shoestring budget, and I've actually been able to get some funding, though, from University of Maryland through intramural grants. For the funding for the gentrification study, I have a fellowship that I was able to get, and so I'll have funding for that particular study. And many other little kind of pots, small pots, but this Atlas main grant that actually, I think they'll distribute the scores today or tomorrow, is a NIH R01. So hopefully, I mean, it's a resubmission, so hopefully we'll see what happens.
So for your earlier research, did you notice a difference, or did you assess the difference between perhaps Latinos and African Americans with your earlier studies?
We did, and actually we found many more commonalities than we found distinctions with respect to physical activity, respect to active play, even with like active transportation. We found many more commonalities. We found commonalities with respect to, so our whole population in the BEAP study, about 25% of the children were obese. The highest rates were those 2 groups as well. So we found more similarities than we found with differences.
My other question, a little bit different, is what are some of the implications of your earlier research? Like, so it sounds like maybe kids shouldn't have TVs in their room, something like that. But what are some of the other implications?
I think one of the other implications was that I found that, you know, you can't really say, oh, you know, don't be sedentary, you know, when mom and dad are sedentary too. Or, you know, get off your iPad when mom and dad have the iPads at the dinner table as well. So so that key, you know, that 38% where they were saying they were sedentary with a parent. So, and I think that may be an underreporting of the actual number. And so I found that, you know, I assumed that the most of it was going to be independently or alone, or even with a sibling, you know. But I was finding that with the sedentary behavior, it's something that has to be modeled, similar to on the other side of the scale, physical activity. Children who see physical activity modeled by an adult are more likely to be physically active, and are more likely to ingrain those behaviors into adulthood. So I think the same is for sedentary behavior as well. You know, we have to all turn off the devices and all, you know, do something, maybe some movement, you know. And so I think that's something that was key in terms of what I discovered, but also the car riding aspect. I don't know how to remedy that one. That one's really a tough one, particularly being in the DMV. So.
Sort of going off of that, how much do you think overlap there is between doing sedentary activity with the parent and the car riding, since that was number 1?
There probably definitely is a significant overlap with that. When you look at some of the other specific behaviors, there was a high rate of sedentary behavior playing video games with a parent. So you did see that, but the car riding definitely, there's definitely a strong overlap because, you know, obviously an adult has to be there to drive. Yeah.
Other questions? Thank you very much.
Thank you.